And we're back. I'm your host, BKP. We're coming to you from the shops of Sycamore Crossing here at downtown Blue Ridge. And this segment's brought to you by the Georgia Cancer Specialist. I'm here with Dr. Whaley. Dr. Whaley, good morning. Glad to have you again this Friday morning in beautiful downtown Blue Ridge. You doing all right, sir?
I'm doing great, but we haven't heard the train.
It's not far.
Yeah, okay.
It's not far. We'll hear that train whistle in a minute. Dr. Whaley, we were talking about some. You wanted to make some comments concerning some things I said and some things you have prepared.
Right,
but I have a couple. I have a couple medical questions. We'll get to those in a minute.
Okay. My wife said, "Let you ask the questions. Keep my mouth shut." Do you want to ask your questions first?
Well, I'll tell you what. We're going to follow what your wife said because I know her. So I'm gonna. If she said it, we're going to do it.
Good.
But here's what we're going to go with. There's a lot of discussion around the internet, and I've been waiting to see you to get some kind of mental, get discussion concerning head injuries, things like that. Hillary Clinton's health. I mean, it is starting to pop up. At first, it was like, is this conspiracy theory? But it is showing up in a lot of places and a lot of comments.
Yeah, I'll agree with that. I've had 5 brain concussions, and I had encephalitis in Vietnam, so I keep up to date on the long-term effects of traumatic brain injury and non-traumatic brain injury. I think it's not up to any debate that Hillary Clinton suffered a head injury. She had to wear those funny glasses with the prisms in them for a while, which is a way of recovering from ophthalmoplegia, or enough head injury to interfere with the motor activities of the eyes.
So when we were seeing pictures of those glasses, that was part of something she had to do for recovery.
Recovery from head,
okay.
From a head issue. I won't say any more than that. Don't know any more about that. There have been a number of people who I don't think have conspiracy theories at all, who are in the media, who have indicated that during interviews, not on camera, but I think if you've been on camera, that she seemed to have episodes of absence, meaning unawareness, or failure to be able to follow what they were doing. Those would be consistent with transient cerebral vascular insufficiency attacks you call mini strokes or TIAs, or some sort of focus thing. That's all I know. I don't know anything more about the state of her colon or how high her blood pressure is or anything else. But she did have a head injury. She did have to wear those glasses. And there are people who don't have an axe to grind that are substantial observers of human behavior, meaning they're media people, that have said, while interviewing Hillary Clinton, she had a period of absence and I was unable to communicate for a number of seconds. I think one of them says that for 4 or 5 hours, she kind of took to the bed and was unable to perform. Jack Kennedy had Addison's disease. That's low adrenal function. He had to have a shot of cortisone, a shot of dexedrine, and all of that stuff every day. It's been well publicized since his death. I don't know how much that may or may not have affected his presidency, but at least at the time they kept it quiet. And now we know that he had Addison's disease from the end of World War II, and that he had to take amphetamines to get cranked up every morning. I don't know that we want to have that in a president.
So the health issues is something that may be something we can follow. It is not so much on the conspiracy theory, just trying to come up with something saying that this lady has something wrong with her medically.
I think you're right. And her physicians have issued a statement that she went through a full physical and was given a good bill of health. And I'm not going to argue with her physicians. So for the official party line is she's in great health.
You don't argue with the physician, I'll be glad to.
Great. All right. I want to go back to driving in here this morning.
I want one more. One more.
Oh, sure. Go.
Yeah, Jane said I could have 2 questions.
No, you have all questions you want.
I want one more because then you just have at it, as they say. Arizona, John McCain. Okay, John McCain, there's some talk on the media this morning about his opponent out there, the lady, and I forget her name, escapes me. She is a medical doctor, okay? And the lady has called into question. He will be 81 years old when he takes oath of office. He will be close to 87 at the end of his term. And she has taken she's made some comments about him medically in that stretch of life. And she's a physician. Could you comment on that? Like men,
Yes,
80 plus.
Yes,
now, I do know, before you go, his mother was in her 90s, and he comes from a long line of...
Strom Thurmond married a girl that one of my classmates dated, and my aunt was his chief of staff. Strom Thurmond stayed in office into his late 90s.
Yes.
At the age of 81, George Burns was having sex with Las Vegas showgirls and did so for 18 more years, stopped at age 99.
Great point.
I have a number of patients.
Do you have that warning sign to flash? Go ahead, Dr.
I have a number of patients who are old men in their 50s. I treat people based on what I think their biological and intellectual age is. President Reagan failed in his dotage, but I don't think everything happened to him in his presidency. We have a very well-built mechanism for replacing people who become disabled in office. We had a Georgia senator who had an intracerebral hemorrhage. He was in his 60s. He went out. Zell Miller took his place. I trust our system. I think John McCain deserves our support, and he deserves our confidence. And if he and his people say, I can do the job, and he goes in there and has something happen to him in 3 or 4 years, we've got a mechanism to replace him.
So I must agree. I mean, followed Strom Thurmond through his career, because he obviously was close to 100 when he
predated you by a lot.
I was going to say
he didn't predate me by so much.
But I do remember he was well in his 90s.
When I was in medical school, he was dating a girl that was being dated by one of my fraternity brothers, and married her and had children by her.
Yes. So
Miss South Carolina.
Well, the only reason I wanted to bring that up as a physician, because his opponent in Arizona has brought that up, his age, and he would be almost 81 when he was sworn in. So.
Let's flip back to a discussion we had a couple weeks ago when somebody told you to take your blood pressure, and we were talking about monitoring your blood pressure. I'm probably more worried about occult high blood pressure in lots of congressmen and senators that aren't being monitored, or maybe their blood sugar or something. John McCain, as a prisoner of war, has a very, very big microscope that the VA has put on him, and is giving him every degree of surveillance and intervention on whatever happens to him, whether it's an ingrown toenail or dental caries. They watch prisoners of war really well. I am confident that he gets a lot better medical care than either you or me.
So where John McCain's concerned, we should be more interested in maybe his liberal votes than his health.
I would be.
we take issue with his policy and not his health.
I'm going to not take issue with anything about John McCain. I was in Vietnam when he was shot down. My commander commented that he knew his father, and John McCain was offered an out. He could have been come home. They were going to let him come home because of his position, and he said, no, I won't come home till the rest of my prisoner friend pilots can come home. I have I just got nothing bad to say about him, and he's got to a point in his life where he may just be saying, I'm going to do what I think's right, and I'm not going to worry about it, and we might not agree with him on a lot of stuff. So if he votes opposite the way we want him to vote, I think he's doing it because he thinks it's right, and we can argue with it, but I'm not going to flagellate him for it, and I'm not going to say he's getting Alzheimer's and he's making the vote because he's stupid.
Well, that's why I'm glad I was able to talk with you this morning, because I heard that comment, and I may take issue with a vote and may argue with him with a vote or something like that. But as far as his ability to serve, I have no question on that, and that's why I wanted to ask you. And
well, as you well know, Zell Miller's a really good friend of mine.
Yes, I do.
And I argued with him, and I will argue with him today, that I didn't think that the Georgia State Lottery was the right thing. I thought it was regressive tax. It was going to tax the poor, and I think it has. And I don't like the scratch-off tickets that are all bought by people on welfare. but I love the man, and that's the one vote I got to argue with him about. So I mean, I even argue with Jane about some of her political opinions. So
Let's not get into trouble.
I don't care. All right. Listen, I'm going to go back to what happened this morning.
Let's not get into trouble.
I had a whole bunch of stuff about medical
Go
research.
ahead.
Medical research. We're not probably going to get to it. As I was driving in this morning, and Jane, we let him ask his questions now. I saw, before I heard your comment, I saw a work crew, a very highly skilled work crew. If you look at this tile we're on, this kind of work can't be done by Leroy. He doesn't know what he's doing. And the most skilled workmen that we have for rock work up here are Hispanics.
Yes, I would agree.
And I saw a crew over there near my office where I went back to find the piece of paper I left because I must be getting Alzheimer's this morning. And they were wearing Trump t-shirts. And I actually slowed down and looked at them. There were about 4 of them and all had it on a Trump t-shirt. That's the first group together of Hispanic workers. And they are really, those people are well paid. And that's the high end of our Blue Ridge construction force wearing Trump t-shirts. I was impressed. So I agree with what you said about them going into the communities, and I think he will turn around a lot of those. Going back to your Obama's coming to town thing, yesterday it was announced that one or two more insurance companies are coming out of the Obama
Aetna, right?
care. Well, Aetna and United Healthcare, I think. But on a national basis, the numbers that are falling out are huge. I think there are only going to be 4 left in Georgia, and only 1 is going to be statewide. But the premium is going up double digits. That's unsustainable. That model can't continue to work. Medicare never did that. And something's got to be done about Obamacare. I believe if you elect Hillary Clinton, that what will be done about Obamacare is that it'll be made nationwide. It'll be mandated by the time she's out of the White House. We'll have a single-payer system, and we'll be like England, and we'll be like Canada, and that's enough of that.
But Dr. Whaley, wasn't that the intent, whether they admit it or not, all along? I mean, when Obamacare passed, the Affordable Care Act, as it's known, when it passed, and we now know if you like your doctor, you can keep your doctor. We now know all of those. I tell everybody, the politicians can say everything they want, but it's the family that gets the envelope out of the mailbox is who knows the truth. The family gets that envelope out that says, and opens it up and says, you're canceled. Your premium's X. We're no longer able to carry you. We will discontinue coverage.
Or with Piedmont Hospital, you can't come back to any of our 5 hospitals because we can't reach agreement with your insurance company.
So it's those people that know the truth, no matter what anybody says from a podium. And what do they call those? The kitchen table issues, right?
That's right.
And that is actually, we are seeing the full development of Obamacare this year. It's been in pieces, but what about, as a physician yourself, the concern from day one that it was never, they knew it would not work. They knew it would collapse under its own weight and that a single payer was the goal all along. What do you say to that comment that you hear?
Well, I think that we've had a couple of whistleblowers that were advisors to the president and to his staff who said that, and I think they've got video of him saying, we don't care what they think, this is what we're going to do and this is what's going to happen. I wasn't there, but the whistleblowers say that they knew that it could not work and that the ultimate goal was to have some sort of a unified national health insurance program. Now, whether that was single payer or not, I'm not going to get into, but that's been the long-term goal of the Democratic Party for at least 25 years. Well, go back to Hillary, when the day they went in the White House. When Hillary and Bill went in the White House, the first thing they did was they organized this huge campaign to redo health insurance. And Hillary is blamed for much of the inflation in insurance because her plan got defeated. But what she was selling got bought into by the the bureaucrats, not the doctors that practice. And most of the people that are writing these laws as physicians have never practiced a day in their life. They got a master's of public health from Harvard before they got their MD degree, and they're on the search for the Holy Grail. And they're bureaucrats, and you won't find some private practitioner in Blue Ridge just go write a law that's going to come up with Obamacare. So they're listening to the wrong group of advisors, in my opinion.
Well, I must agree. Let me ask you a question. What do you think will be the outcome of health insurance, or what do you think we need to go to? Would you mind sharing? I mean, as a physician,
I've had a program. I started the first HMO in Georgia. I've had an idea forever that you do not do well if people don't have skin in the game.
I agree with that.
All right. So they say that medical care is 10 to 11% of our income. So my idea was that you have a sliding scale that everybody puts 5% of their income into, so that if your earnings are $19,000 a year or $24,000 or whatever you set the floor at, you put in a couple of bucks. If you make $400,000, you put in 5% of your income into this pool, so to speak. Now, you don't file an insurance claim until you've used up your 5%. Well, that eliminates the insurance claim for the flu shot and the office visit, and the infrastructure of all this huge insurance company filing a claim for every aspirin you take goes away. So much of the expense of medicine is gone. Then after you've spent your 5%, you got a $60,000 a year income, that's $3,000. Above that, your insurance kicks in, and there's no deductible, and there's no copay, and there's no nothing. I think that would cut insurance costs in this country dramatically. It'd be easy to administer, and then people could go pick their own doctor. They'd have skin in the game every time. It would lower the cost when people have to pay the first dime of their care, and they pay the first $3,000. A lot of people, every day I write a prescription, and somebody says, well, my insurance won't pay for that. Let's say Viagra, for example. I said, well, they're not supposed to pay for your Viagra. If you want it, here's how much it costs. Here's a coupon to help you get it, and I can put you in contact with a Canadian pharmacy. But there are a lot of people whose mindset is, I'm not responsible for paying for my own medical care. And that if the insurance company doesn't pay for it, I'm not going to do it. And that puts a burden from the consumption side that I think you would fix if they had skin in the game. And everybody has, as a part of their mindset, I pay for this entry-level part of my medical care. A lot of the infrastructure would go away, and a lot of the big expense would go away.
Well, let me ask you one more thing on that. I think one of the major mistakes that was made is, I think health savings plans are awesome. I thought those were awesome, the health savings plans, that you could put money into a health savings plan. I thought those were great.
Well, that's about what I'm talking about.
Right,
except
exactly.
That it's a nationally enforced, everybody's in it. We don't call it a health savings plan.
Right, exactly. But you have a health savings plan.
We call it a low percentage sliding scale for everybody.
Let me end this morning and make sure anything that you wanted to bring up that you have time to do that. I'm not limited on my time. We talk about veterans, and I know you talk about Vietnam. Talk about veterans care and what you think concerning the VA, and probably that would take a long time. But in a nutshell, as a physician, veterans care. I mean, I have often got confused on why a veteran, shouldn't be able to walk in anywhere and get care. I've always got concerned about, we put people in this box and you have to go here.
This all began back following World War I, I guess, it goes back to the Civil War, because when I was a child, we had the Confederate Veterans Home up in where North Fulton Chastain Park is now. But there's always been this thought that in the Western European philosophy that the government takes care of their wounded veterans or their widows and orphans. It became a specialty after World War II. And there's a lot of specialty medicine, particularly recovery from traumatic brain injury and all that sort of stuff, that should be focused in centers of excellence. And the Walter Reed Hospital is the center of excellence for the Afghan and Iraq, Persian Gulf traumatic brain injury patients, and they need to go there, and the Burns Center in San Antonio, Texas for burns and that sort of thing. But the idea that all of your high blood pressure and your diabetes that is in the VA system, that's where the big delays are. And yes, I think that could be taken care of in the private system. I'm one of the few people that take federal insurance. I get patients, federal veterans insurance and federal what do they call it, health care for life for military families. And I get patients that come 200 miles to see me for oncology because no other oncologist will do it. Reimbursements are terrible. It's as bad as Medicaid. I take everybody, but there's a bad issue there with the bureaucratic administration of the VA, the delays in getting people in for what you would call routine medical care. All of the publicity about the people that died while waiting for their first appointment, mostly in Arizona. You got 2,000 patients trying to get an appointment, and 40 of them are ones that are trying to get an appointment for health care, and for chest pain, and yes, some of those had heart disease, and it took them 5 months to get their first appointment. In Canada, if you want to get your hip fixed, it's going to take you a year to get an appointment. So that's really just single-payer medical care. Today, you can look at and see how efficient it is. It's inefficient. It's single-payer medical care, and those veterans that are wounded and injured in a special way, they take great care of them because they have centers of excellence. It's the great, huge number here that are being taken care of by federal programs that are inefficient and don't work.
So the VA as a whole has turned into what we would see as an example of single payer could result in.
Correct.
But let me see if I got,
except for the wounded veteran.
Right, because I want to see if I have this right before we leave. When the VA started, there was you have specialty where war-related injury, war-related, whether it be things that are psychological, whether it be burns, whether it be war-related, and they were specialists to deal with that, because the physician in the private sector does not go through quite that training.
That's correct.
And so that was specialist. Then it morphed into, hey, I have high blood pressure. I need blood pressure medicine. I could visit you or any physician.
Right.
That's where we could take care of, and we can turn the VA back into specialist units and focus.
Yes, and let's take places like Alaska. So you've got a lot of veterans in Alaska. You don't have a whole bunch of doctors. You have a VA medical clinic somewhere in Alaska that does take care of high blood pressure and diabetes. But in a big metropolitan area where you've got lots and lots of family doctors and everything else, there's not any need for the VA to take care of everybody who walks through the door with their glasses and their hearing aids and everything else. That could be taken care of in the private sector. But the hospital I was in Da Nang was the first hospital in the world to use frozen blood and artificial skin. I mean, advances in medical care, trauma care, these are largely happen in the military. And in the treatment of burns and the treatment of traumatic brain injury, those largely happen in these military situations where you have huge numbers of patients with a common sort of injury. And they need to be in areas of expertise, and that's what's done. But when you take a guy like me, I'm eligible for Agent Orange, and I've got two diseases. I could get an Agent Orange pension if I wanted it. I mean, I can go get my glasses and my hearing aid and everything else from the VA. I think that's wrong. I shouldn't be doing that. I can afford to do it on my own. I'm going to do it on my own. So there's something wrong there about the people who want bottom dollar coverage, or the veteran who wants somebody to take care of him, who's got a job and been working for the last 40 years at the post office, or working 40 years and having a job of his own, who wants to go to the VA, will drive all the way to Atlanta just so he doesn't have to pay for his medicine.
Well, Dr. Whaley, I don't want to be the one responsible for you being late
I'm
for work.
not going to be late. I got plenty of time.
Oh, okay. I
mean, if you got to get off,
No.
All right, here you go. I got a couple of things.
It's just I know I don't want to be responsible for you being late.
I'm not going to make myself late. I got a couple of things.
Okay, you go right ahead.
What was the hottest news item of the last 3 days? The cost of the EpiPen.
Yes. Go ahead.
Right.
Yes.
EpiPen is a life-saving, absolutely mandatory new tool. Not so new, but tool. My wife and I had a woman across the street from us 30 years ago who got stung in the lip by a yellow jacket hanging out the window of the house across the street, watering her plants. I just happened to be standing in the street, my wife on the front porch, and we saw her collapse. And we broke into her house and got upstairs, and her head was this big around with a bee sting, and she was in the process of dying. We had to pound on her chest, call 911. They gave her a shot of epinephrine. Well, that woman should never walk down the street without one in her pocketbook and one in her car and one next to the toilet in her house. So EpiPen is a mandatory thing for people with the bad peanut allergy, with the bee sting allergy, that have these huge allergic things. When that EpiPen, the dose of epinephrine that is in that pen costs about $1. The delivery system of the being able to go mash and then it shoot into your leg was owned by a company that, at the time that it was sold to the lady and her company own it now, cost $100 for every EpiPen. Price has gone to $600 over a period of years for no apparent reason other than profit. And so now they give out a coupon that says we'll give you $300 off on an EpiPen, which everybody thinks is great, except the insurance company is still paying that other $300, and nobody at Medicare age is allowed to use the coupon. So something is wrong today with that part of the pharmaceutical industry. Now, I want to flip over to all of the great things that are happening in medicine. Our pharmaceutical industry has taken the human genome and they have analyzed it. And I sent 2 patients' tumors yesterday off to have genetic paneling done, that when it's concluded will be able to tell me what type of treatment to give, rather than just breast cancer treatment or colon cancer treatment. That's over here now. It'll be treatment directed to this particular gene profile or that particular gene profile. And if it wasn't for their pharmaceutical companies putting billions of dollars into that, that wouldn't be there. And that's life-saving. So here you got 2 different parts of the pharmaceutical industry. One that are, in my opinion, ripping folks off on the EpiPen side, and on that guy who had the pill for leprosy, I think it was. And then we got the great stuff going on over here. So I was going to give you a big thing about research today, and we'll do it another day. But I wanted to talk about the EpiPen and at least say that the pharmaceutical industry gotten a lot of bad press from that one thing in the last day or two, and they deserve every bit of it they get. But 98% or 99% of the pharmaceutical industry is out there doing research trying to make it better for you for your high blood pressure treatment, or make it better for you for your cancer treatment. I want to support them.
Well, I must agree with that, because lifespan has increased and so forth. So there, we have made those advances in medicine and with the pharmaceutical industry, and then you have the other side, and that's what we're talking about with you have the other side that is just confusing to me.
How did we get through half an hour without a Zika update? We didn't talk about the Olympics.
I don't know. Well, because you know why? Because we talked about Trump T-shirts, which I think are relevant, and I don't mean it. I think you've seen something. I really think you've seen something this morning that the major media is not catching on to. I think as simple
FetchYourNews.com, we caught on to it.
Exactly. I think exactly what you said this morning is what the mainstream media is not catching. They're all going to be shocked, and they're not seeing what you've seen. And I think that is big. And I think it's everywhere.
Yeah, I do.
Dr. Whaley, I appreciate it. We are going to continue right after these messages. We're going to have the best political discussion, not just in North Georgia, anywhere else you can find. Julian Assange has been on Fox, he has a October surprise coming up. It has probably Miss Hillary Clinton very, very nervous. So they are out there with their talking points. We're going to get into that with our next guest in the group that we have assembled. And apologize for that. Didn't turn my phone off before I started. And we've been here with Dr. Whaley every Friday morning at 8:15 from the shops of Sycamore Crossing in Blue Ridge. Lonnie, take us a break.